Upper arm, elbow, and forearm anatomy review.
The elbow is a relatively simple hinge joint which only allows for flexion and extension. The elbow joint occurs at the junction of the humerus or upper arm bone and the ulna, which is the larger of the two forearm bones, and the radius. The elbow allows for flexion and extension of the forearm relative to the upper arm, as well as rotation of the forearm and wrist. When the elbow is fully extended, the elbow locks. The humeral-ulnar joint is formed by the articulation of the trochlear notch of the ulna and the trochlea of the humerus. It is a simple hinge joint and allows for the movements of flexion and extension. The humeral-radial joint is formed by the articulation of the head of the radius and the capitulum of the humerus. It is a ball and socket joint. The proximal radial ulnar joint is formed by the articulation of the head of the radius and the radial notch on the ulna. In any position of flexion or extension, the radius can be rotated in. The movement includes pronation and supination. Due to the movement at the proximal radial ulnar joint, the radial head rotates on the radial notch of the ulna and allows for the movement of pronation and supination. Supination of the forearm occurs when the palm faces upward. The way that I remember supination is you should be able to cup your hands and carry a bowl of soup if you are supinating. When the forearms are supinated, the radius and the ulna are parallel to each other. Pronation occurs when the palms are facing downward. When the forearm is pronated, the radius rolls medially over the ulna. The elbow, unlike other joints, has ligaments on both sides. These are triangular bands which blend with the joint capsule. They are positioned so that they always lie across the transverse joint axis and are therefore always relatively tense, and impose strict limitations on abduction, adduction, and axial rotation of the elbow. The ulnar collateral ligament has its apex on the medial epicondyle. Its anterior band stretches from the anterior side of the medial epicondyle to the medial edge of the coronoid process, while the posterior band stretches from the posterior side of the medial epicondyle to the medial side of the olecranon process. These two bands are separated by a thinner intermediary part, and their distal attachments are united by a transverse band below which the synovial membrane protrudes during joint movements. The anterior band is closely associated with the tendon of the superficial flexor muscles of the forearm, even being the origin of the flexor digitorum superficialis. The ulnar nerve crosses the intermediate part as it enters the forearm. The radial collateral ligament is attached to the lateral epicondyle below the common extensor tendon. Less distinct than the ulnar collateral ligament, this ligament binds with the annular ligament of the radius, and its margins are attached near the radial notch of the ulna. When the arm is extended, with the palm facing forward or up, the bones of the arm or humerus and forearm are not perfectly aligned. The deviation from a straight line occurs in the direction of the thumb and is referred to as the carrying angle. The carrying angle permits the arm to be swung without contacting the hips. Women on average have smaller shoulders and wider hips than men, which may necessitate a more acute carrying angle, or less angle than in males when measured from the outside. There is, however, extensive overlap in the carrying angle between the individual men and women, and a gender base has not been consistently observed in scientific studies. This could, however, be due to the small sample size in earlier studies. A more recent study based on a sample of 333 individuals from both genders concluded that carrying angle is a suitable secondary sexual characteristic and indicates sexual maturity. The angle is greater in the dominant limb than in the non-dominant limb of both genders, suggesting that the natural forces acting on the elbow modify the carrying angle. Development, aging, and possible racial influences add further to the variability of this parameter.